The shock of returning home. Do you know why your baby or toddler has a behavior problem and you are finding it hard to cope on your own? When I returned to India after retiring from the UK National Health Service as a doctor, teaching medical students, training junior doctors, and teaching nurse prescribers, I was shocked. Honestly, I can write and publish a book that will shock you. I asked myself what went wrong in this country 20 years ago, who I am, and why I am qualified to say this. I am Dr. Kadiyali Srivatsa. 50 plus years clinical experience, pioneer to digitalize patient-centered care long before tech giants invaded the arena to inflict fear and monetize healthcare. I have published numerous articles and books, and now I have asked ChatGPT to think like a human doctor and created Dr. Maya AI. Spent more than 50 years as a doctor, including more than 30 years as a staff pediatrician and 10 years as a family physician in the British National Health Service. I have examined, treated, and followed thousands of children from birth into adulthood. I published in the British Medical Journal. I train doctors who now work in hospitals across the world. And I want to tell you something that no politician, no school principal, and no Bollywood celebrity will tell you, because the truth is uncomfortable. The behavior you see on Indian roads, in offices, and in your own home, it was created in childhood by us. The children born 20 to 30 years ago are today's rude drivers, aggressive officers, and moody teenagers. They were babies and toddlers. That was the era of India's explosive economic liberalization. Suddenly, both parents were working. Grandparents were left to manage alone or replaced by domestic helpers. Screens, television first, then mobile phones became the babysitter of choice. Honestly, I can write and publish a book that will shock you. I asked myself what went wrong in this country 20 years ago, and I know the reason. This is the solution. Do you know why your son or daughter, hidden in plain sight, a clinical and developmental atlas of normalized childhood behaviors and their lifelong consequences? Why just a phase is the most dangerous phrase in pediatrics. The biological architecture of the human mind is laid down in the first 1,000 days, and almost every adult psychiatric, behavioral, social, and even somatic disorder has identifiable footprints in childhood. Yet across cultures, and especially in primary care pediatrics in low and middle income countries, LMICs, these footprints are routinely flattened by reassuring formulae. She's shy, boys will be boys, he'll grow out of it, it's the age. The longitudinal evidence base now decisively contradicts that reassurance. Birth cohort studies, longitudinal study of risk and adaptation, and the Bucharest Early Intervention Project, together with the CDC Kaiser AC study, Felitti and Anda 1998, demonstrate dose-response relationships between specific pediatric behaviors and adult mental illness, addiction, criminality, somatic disease, unemployment, and premature mortality. This document maps those relationships across the developmental lifespan, distinguishes truly normative variation from clinical red flags, and notes the cultural and socioeconomic mechanisms particularly relevant to India that can lead to these signals being missed. Please scan the QR code if you don't want your sons and daughters to grow up to be young adults like the ones you see all around you. And thank you.